you for joining us tonight. So again, my name is Emer, and I will be the speaker for tonight. Of course, we would like to thank Philippine Nurse Association UK for making this event possible. So for your bowel assessment, it's for 8 minutes, okay? And there are 4 possible scenarios that you might be getting on the examination. Again, it's 8 minutes and 4 possible scenarios. So, Emmer, how many scenarios am I getting on the day of the examination? It's only one, okay? It's only one out of 4 possible scenarios. What do we know about bowel assessment? May I ask the crowd? You know me, I love asking the people in our webinar. What do we know about Bristol? Have you ever heard of the Bristol stool chart before? Pauline said the 7 types of stool we have to recognize. Thank you, Pauline. That's very good. And of course, like what Pauline said, we have 7 types of stool, so which I will be showing you in a minute. Okay? So let me ask the crowd again. What is the normal consistency of stool? So from 1 to 7, what is the normal stool type? Maria Nina said 4. Any other guesses? Give me a range. PM said 3 to 5. John said 3 to 4. Kathleen 3 to 4. Well done. That is the correct answer. So according to the Bristol stool chart, the normal consistency of stool is 3 to 4. Yeah, it's 3 to 4 according to the chart. Sorry guys, we are talking about poo tonight. Yeah, we're talking about stool tonight. So hopefully you're not eating while I'm talking. So just don't imagine. Yeah, just don't imagine while I'm talking about stool tonight. So that is correct. Okay. How about what if the patient is constipated? What would be the score of the patient? Let's say I experience constipation. What do you think is the score? Nina said 1. Mai also said 1. PM said 1 to 3. Pauline said 1 to 2. That's correct. So it's around 1 to 2. Okay. How about if the patient experiences diarrhea? What would the score be? Well done. Thank you, guys. So the score would be 6 to 7. Well done. So you're doing your research. That's very good. Okay, so let's move on. So again, to summarize, there are 7 stool types. So the normal stool would be, it fall under like 3 to 4. Diarrhea would be 6 to 7. And then constipation is 1 to 2. Well done. Thank you for doing your research for tonight. So as you can see on my screen, this is the Bristol form scale. So you can see the types from 1 to 7. Okay. Or Bristol stool chart is also known as the Mayer scale. Okay. The Mayer scale, but it's widely known as the Bristol stool chart. This photo was based from Royal Marsden 10th edition. So type 1, as you can see on the photo on your screen, it's separate, hard lumps. It's like nuts, okay? It's hard to pass. Remember, like what you mentioned earlier, 1 signifies constipation, okay? Type 2, it's sausage shaped but lumpy, okay? Type 3, it's like sausage but with cracks on its surface. So type 3, and then the next one, type 4, which is on the normal range. It's like a sausage or snake, smooth and soft. What a nice description, okay? Sausage or snake with smooth and soft. And of course, number 5, it's soft blobs with clear-cut edges, and it's passed easily. So we're now heading to the diarrhea section of the scale. So number 6, type 6, it's fluffy pieces with raised edges, a mushy stool. And of course, number 7, it's watery, no solid pieces, entire liquid. Okay, so Emer, are these the photo that we'll be seeing on the examination? We don't know. Then we don't know. You might be seeing this exact photo in the examination or similar. Yeah, of course, similar. I don't think that you will be seeing an actual photo of a poo. It might be just this, like a drawing, or like like a drawing. Okay, so please remember your Bristol stool chart. So we will now move on with the marking criteria. So again, guys, please remember that the Bible for the examination is the marking criteria. Yeah, so the one I'm showing you on your screen is version 1.6, and it was updated last August 2022. Again, it's your responsibility before you go to your examination to check the recent or the current marking criteria, because again, the test centers or the NMC, they don't announce or they don't normally announce if they are updating their marking criteria. So if you're watching this video in the future, the things that I might be saying now might be different when you're about to do your examination. Yeah. So typically, the NMC, they changes they update the marking criteria every so often, sometimes every 4 months or every 3 months, and they don't announce, yeah, unless there is like a major change. So please do check your marking criteria before you go for your examination. That is one of the tip for the examination. All right, so we will now discuss the marking criteria. How are you going to pass this station? So the Bristol Stool Chart station is a writing station, yeah. You don't need to perform anything apart from writing. So number one is to complete the Bristol Stool chart accurately and signs, dates, and adds time where required. So later at the end of my slide, there is a sample documentation. Yeah. Number two, so that is easy. Again, I did mention this on my previous webinars. It is important that you check or you complete your documentation because, of course, we don't want to fail the examination because of not completing our document. Again, based on the first criteria, expect that you need to sign it, that you have to put the date, and you have to put the time where required. Again, if it's not written on the marking criteria, it's not needed. Okay? So number two, handwriting is clear and legible. So that is easy and that is easily understand. We don't want to fail because the assessor cannot read your handwriting. Number three, of course, you have to ensure that the strike-through error retain legibility. Again, if you committed a mistake, again, how to rectify it? Of course, put a strike-through. Okay, that is it, and maintain legibility. So I know I recognize that different trusts teach this the Osce differently. So you might be hearing from your practice educators or your facilitators saying put the word error, put your initial, put the date, whatever. Again, you can follow them, that is fine. But again, if you go back to the marking criteria, it only tells you to put a strike through and that is it. You don't see writing the word error, you don't see the word writing the initial, that means it's not necessary. But then again, if you want to follow them because let's say based on the experience, it's working, then you follow them, yeah? We will now go to the scenarios. Okay, so we're now done with the first, second, and third criteria. So the first, second, and third are easily understandable. So the fourth criteria, it talks about the first two scenarios. Remember, I did mention there are 4 possible scenarios in the examination. And then we have, for the first one, it falls under constipation. And under constipation, there are 2 possible scenarios. It's scenario A or scenario B. Okay, so for the first scenario or the first 2 scenario, you might see type number 1 or type number 2. Okay, got it? For the first 2 scenario, you might see type 1 or type 2, which again conveys constipation. So as you can see in your screen, so the first criteria says correctly recognizes Bristol Stool type 1 or type 2. Okay, and appropriately and proposes a plan of care to reduce or prevent constipation. Actually, the first criteria, it tells you the answer already. Yeah, the marking criteria is telling us the answer already. It's either type 1 or type 2, but you need to recognize what that is. So they will be giving us a photo. Of course, these are the answers. We will discuss why these are the answers. Yeah, because again, it's important. Again, I don't want you to just memorize this. Okay, remember guys, I don't want you to just memorize this. We need to understand this because again, in the future, once you receive your pen, you need this information as you practice as a nurse. Yeah, it's important you know why these are the answers. So let's proceed with the next criteria. So considers possible causes of constipation such as medication and explores potential alternatives. Let me ask the crowd, what are the medications which can cause constipation? Well done. I can see answers, so thank you. As they said iron, ferrous, I'm assuming that it's ferrous sulfate, codeine, opioids. What else? Thank you for your answers. Let's run to the groups of medication which can cause constipation. So number 1, I think it's one of your answer. Of course, your opioids, yeah? Your morphine. That is why in your ward, if your patient receives morphine long-term, what is the other medication prescribed? You normally see laxative, yeah? So another one is, of course, your NSAIDs. Thank you for your answers. NSAID, again, what are those? That might be an aspirin, that might be ibuprofen. Okay, well done. Thank you. I saw another one. So Nina said blood pressure medication. That is correct. Typically, calcium channel blockers, beta blockers, or antidepressants. What else? Ferrous sulfate. I think some people answered that. Well done. What else? Antihistamines, such as there you go, antihistamines such as Benadryls. And of course, medication for nausea, such as ondansetron. There you go. Thank you. I can see the answer, antiemetics. So this might be one of the culprits why the patient is experiencing constipation. And we need to take note of that um, to create a care plan. Yeah. So this is your first answer for your care plan, is to consider the possible causes of constipation. Medication, of course, explores potential alternatives. Okay. Well done. Next, offers dietary advice such as increasing fiber, fruit, and vegetable. Let me ask the crowd, what is the reason behind this? Why do we need? I know we do talk about this every time, to advise patient to increase fiber and fruit. But what is actually happening inside the body once you take fiber, fruit, and vegetable? Bulk forming, and of course, they sweep, yeah, your intestines, so you will be able to defecate. So again, I can see that someone mentioned it promotes peristalsis. Okay, so well done. I know the words tonight are a bit morbid, yeah, defecate, poo. So I hope you're not eating while discussing this one. And I hope you're enjoying so far, guys. Yeah, thank you very much. And next is, of course, proposes obtaining a prescription for laxative. Definitely, that is the drug of choice. Let me ask the crowd again, what are your laxatives? Miss Retlaxido, I know we use that in care homes. You also use that in the hospital. Senna, Bisacodil, Movicol, there you go. Lactulose, there you go. Your docusate sodium. Well done. Thank you, guys. Senna, of course. Well done. Thank you for all your answers. Yeah. Again, guys, for the guys who's listening here in this call, try to answer in your head as well. Next, consider dehydration and encourages increased fluid intakes. Of course, for obvious reason, the patient might not be able to defecate because probably the patient is dehydrated. Yeah. And of course, we need to encourage to increase fluid intake. Okay. The next one is, of course, to encourage physical movement where possible. Remember, physical mobility, of course, it promotes peristalsis. Okay. And encourage not to ignore the urge to defecate. And lastly, last two, you have to promote positive toilet habits. Going to the toilet should be a positive experience. You promote privacy, positioning, breathing exercises, and spending time to go to the toilet. Okay, it's as if you're just going for a shopping. And you have to recognize the need to continue to assess the bowel of the patient. According to the marking criteria, for you to pass this particular examination or station, you have to identify 5 aspects of care. So from the things listed above, except the first one, you have to identify 5 relevant. Okay, if you think about it, all listed are relevant. Yeah. And if you want a partial mark only or a partial pass, which is equivalent to a fail, that is 3. Okay, if you've only written 3 out of the following listed on your screen, you might fail the examination. Of course, write everything you can. All right. So as you can see on my screen, I've highlighted the words that you might need to remember. Again, so let's say for the second criteria, constipation, the possible cause of constipation. You don't need to remember this or memorize this word per word, okay? Look for the keywords, probably create a mnemonic. How will you be able to memorize all this, okay? Let's say for the first sentence, possible cause of constipation, okay? The next one, the dietary advice. Next is, of course, your laxative. The next one, the dehydration and of course increased fluid intake. Next is physical movement. Next is not to ignore urge to defecate, your positive toilet habits, and of course, to assess the bowel frequently. Okay? I hope that helps. I will give you an example of a scenario that you might encounter in the examination. Again, guys, this is not the scenario in the examination, okay? I just made this up. All right. Example, you are a nurse working in an acute ward. Jason, which is one of your patients, seems irritable and complains that he has not passed stool successfully in the last couple of days. You assess Jason, escalated your findings, and monitored his bowel movement. A couple of hours later, Jason called you and said he had finally passed the stool. So your task is, please identify the Bristol stool type and write your plan of care. Let's say, assume it is today and it's 8 o'clock in the morning. Let me ask the crowd, what is your answer? Thank you. Well done. So for the guys who's just thinking now, if you answered 2, that is wrong. I'm just kidding. Yeah, 2 is the correct answer. Definitely. There you go. If you answered 1, you need to wake up. Yeah, you need to wake up. Of course, this is type number 2. Let's recall you. Type 2 means sausage shaped but lumpy. Again, I'm not sure if this is the exact photo in the examination, but of course you will be seeing similar photo with sausage shaped but lumpy photo. Okay, without looking at your marking criteria, if you have one and you're in front of you, what would be the plan of care? Okay, give me the keywords that we just discussed. Okay, guys, if you're listening close attentively, without looking on your marking criteria, what would be the plan of care? Okay, give me the keywords. Laxative, JC, well done. The possible cause, dietary advice. What else? Hydration, increased fluid intake, exercise. See, that is easy. You can do the examination after today. I hope that's helpful, yeah? I hope that's helpful. An assessment, well done. Thank you, Paul. You only need to remember the key words or the main point of each marking criteria. You don't need to remember it word per word. This is an example. Guys, this is just my take on the examination. Now, this is not the answer. Okay, so plan of care, an example of which is I will consider the possible causes of constipation, such as medication, and explores potential alternatives. Another one is I will advise Jason to increase fiber, fruit, and vegetable consumption. I will escalate with the doctor and propose a prescription for laxative. I will also check the signs of dehydration and encourage increased fluid intake. I will encourage Jason physical movement where possible. I will encourage Jason not to ignore the urge to defecate. I will promote positive toilet habits. And of course, last but not the least, I will continue to monitor Jason's bowel pattern regularly. And that is my name, my signature, my date, and my time. Emer, I thought it's a care plan. Why there's no aim of care or why there's no reevaluation date? Because it's not written on the marking criteria. Yeah, this is not a care plan station. Yeah, this is not a planning station. It's a bowel assessment station. So we don't know. You might see a similar paper, similar your care plan, but I don't think that you will see aim of care. I don't think that you will see the evaluation date. Why? Because it's not written on the marking criteria. All right, we will now proceed with the next 2 scenarios. Okay, so the next 2 scenarios talk about diarrhea and loose stool. On your screen, it says here, correctly recognizes Bristol stool type 7 or type 6 and proposes plan of care to reduce or prevent diarrhea. Okay, so it's telling us that on the examination, the possible types that you might be seeing are the following. It's either 6 or 7, and that is it. Okay, the marking criteria is basically telling us the answers already. You just need to identify what type that is on the examination. All right, so let's go through the answers. Okay, let's go through the answers. Number 1 is, of course, considers possible causes of loose stool. So that could be food poisoning. I don't know if you ever experienced food poisoning before. Definitely, it could cause diarrhea. An overflow. Guys, let me ask the crowd, what do we know about overflow? There you go. Thank you for your answer. All your answers are correct, Miss Red and Nina. So normally, it's the culprit is constipation. Okay, the culprit is constipation. If the rectum is full and it's not emptying, what happens is starts to leak because you're constipated. Um, it starts leaking. That's why it's called an overflow. Okay, yeah. If you're not familiar, if you've never heard of that word before, yeah. Next is healthcare antibiotics. Yeah, we all know that antibiotics can cause diarrhea. Healthcare acquired infections such as your norovirus. Okay, it's nearly the time of the year wherein it's norovirus season once again. So norovirus is also known as your winter vomiting bug. Common symptoms if you have a norovirus would be, of course, nausea, vomiting from its name, and lastly is your diarrhea. Okay, one of some of the common symptoms of norovirus, and of course your C. diff. Okay, your C. diff or malabsorption. Can you guys enumerate what are the conditions related to malabsorption? Of course, your celiac disease, your Crohn's disease, definitely, your cystic fibrosis, your chronic pancreatitis. So those are your common conditions which are linked to malabsorption. Yeah. So I hope you're enjoying our session so far. You're learning something. Um, Next is, of course, you have to offer dietary advice. So this time, compared to the previous scenarios or previous, with constipation, now is the time we have to reduce, of course, consuming fruits and vegetable because again, we've discussed the reason behind it earlier. And of course, you have to propose obtaining a prescription of anti-motility. So let me ask the crowd again, what are those anti-motility medications that you can think of? If it's non-infectious, guys, yeah, if it's non-infectious. Loperamide, of course. Lomotil, there you go. Thank you. Those are your common motility medication, of course. Thank you. Imodium, thank you, Jill. Next is consider dehydration and encourages increased fluid intake. Of course, diarrhea, definitely, we have to think of dehydration. Let me ask the crowd again. What are your common signs of dehydration? How will you know that the patient is dehydrated? Sunken eyeballs, Nina said. Dry skin. What else? Poor skin turgor. There you go. That's very good. Yeah. Well done. Dry lips. There you go. Thank you guys for sharing all your answers tonight. First, of course, yeah, there you go. Those are your common. How about the vital signs? What normally happens if your patient is dehydrated in terms of vital signs? But always remember, there is an early sign of dehydration and of course a late sign of your dehydration. So that is your assignment. Yeah, that is your assignment to think what are your early signs of dehydration and your late signs of dehydration. Of course, we have to consider perianal skin integrity. Remember, of course, your patient experiences diarrhea, can you imagine? It can damage the skin. So definitely consider perianal skin integrity. And of course, positive toilet habits. And lastly is, of course, recognize the need to continue assess bowels. Same with the previous scenario. Again, for you to get a pass, definitely you need to answer 5. And if you want to fail it, of course, you are only writing 3. Let's try and analyze the answers. If you think about it, the first answer is a possible cause of loose stool. Second is, of course, your infection control measures, patient isolation, sending sample of culture. Next is reducing fruit and vegetable or your dietary advice, obtaining anti-motility medication. So dehydration and increased fluid intake is the same from the last one, even the positive toilet habits. So it makes your life easier because 2 of the items from the last scenario are the same. Okay, I don't think I have an example for this one, but I hope you will remember the keywords for each answer. Yeah. So the possible cause of loose stool, your infection control measure, your dietary advice, the dehydration and encourages increased food intake, your perianal skin integrity, positive toilet habits, and assess the bowel. You don't need to memorize this word per word. You can reword it You can paraphrase it. But again, of course, the main thought of the criteria is still there, okay? Definitely, it should not change, okay? It should not change. You might be asking, why are we discussing this in more depth? Because I want you to understand why these are the answer. Because if, again, if you are just memorizing this, that is superficial. Of course, you will definitely remember this more if you understand the reason behind each answer, okay? That's the most important thing. Again, memorization is superficial, but understanding each answer, that's more meaningful if you're preparing for examination, yeah? So I hope that is a good tip for the examination. And last but not the least, the fifth criteria is to, of course, act professionally.